y'all, it is Ruby Jones, your favorite dental diva, back again for a part 2 about dental labs. Please, if you did not watch the previous video, go back and watch it so that you can clearly understand what a dental laboratory is, when we work with them, why we work with them, etc., etc. The devices that we are ordering from the dental laboratory, like crowns, like bridges, like dentures or partials or retainers, all of those things are going to almost always require at minimum 2 appointments. There are certain situations where we may need multiple or even more than the 2 appointments. For example, for crowns or bridges, that first appointment that we are seeing the patient for is going to be a prep appointment, a prepping appointment. We are taking an impression of the tooth. Like I showed you guys in the last video, an actual impression nowadays, because we got to get fancy over time, there is a scanner that you can actually take a digital impression. So the crown is just one example. If we are making dentures, the patient has to come in to get impressions, okay? And so again, the first appointment is going to be the prep appointment, the impression appointment. That is going to be the initial visit. Your patient is not going to leave with the device that day. That is clear. You have to be clear about understanding that, okay? And of course, you have to think about it. We talked about dental labs. It's because in the dental office that your patient is coming to, in your dental office, more than likely, we just do not have the capability, the tools, the equipment, the skills to fabricate, or the time, or it goes on and on and on. This is why we network and we send the impressions and the prescription off to the dental lab, okay? And so please understand, again, that first appointment, we are just preparing the tooth, taking the imprint, getting the impressions, the scanning, the photos, all of that. And your patient will be dismissed as we will schedule them depending on how long the lab, what it is that we're ordering and how long it takes the lab to fabricate or customize what we're ordering, right? So we will schedule them back 2 weeks, 3 weeks, etc. Whatever it is, you got to look at your calendar and figure exactly, you should know though, you should figure out exactly how far out you are scheduling this patient for. When they return, that is going to be the second appointment. And the second appointment, we usually will call it a seat appointment, like a seat, like we are seating the crown. Or there are a lot of folks that will just call it a delivery appointment. Sometimes, if let's just say there's 3 appointments, the first appointment when we get the impression or the imprint, when the patient comes back for the second time, we call that a try-in. So it's literally like a wax model of some sort, or just the makeup, the preliminary version of the final. And this is for us to, hence the word, try it in, to make sure it fits, to make sure that it's the right shape, it's the right shade, acrylic shade, the gum shade, the tooth shade, the stump shade, making sure that the doctor is happy, that the patient is happy. If everything is great, we would send that back to the lab and let them know everything is good, stamp of approval. They can go ahead and fabricate the final device. If something is not right from that try-in appointment, we would also send it back. That second appointment, if it is a try-in appointment, we are sending that off, whether it's great or whether we need changes, and we are bringing the patient back for a third time, which is usually going to be, if not a try-in, it's going to be the final seat or delivery appointment. Okay, so that's a very special case for the most part if we're going to be seeing a patient at that 3 appointment. But hey, it happens. There's some times that we are just unsure, and of course the patient satisfaction and the doctor feeling great is a super important thing. And so we rather have a try-in appointment so that we can bring them back for the final device. That is a great thing. But typically, you guys, it's going to be a first appointment to get all of what we need. And then we bring them back for the second appointment, which is going to be the delivery or the seat appointment of whatever device it is that we place the order or prescription for. Okay? So I hope you understand this video. Please let me know if you have any questions, comments, or concern. Stay tuned for part 3.